Hello, everybody, and welcome to my second video in this short course on Introduction to Economic Evaluation. And this video today is on the specific area of economic evaluation and health system strengthening. So just to recap the material that we've already covered, in my previous lecture video, in part 1, we spoke about the role of economic evaluation within universal health coverage, and we applied this learning through watching a documentary about a health technology assessment agency in the UK called NICE, and how they make decisions about the inclusion of new technologies into their health system. So what is the role of economic evaluation in universal health coverage? And then we also went through what is economic evaluation, the core components of economic evaluation, and how to interpret your basic economic evaluation results. So in this video today, what I want to do is to frame economic evaluation in relation to health system strengthening interventions, which are different from your new technologies. So we're going to go through and recap on the questions that are commonly considered in economic evaluation. So that's to do with the new technologies or models of care. And then we're going to speak about, well, what are health system strengthening interventions and why would economic evaluation of health system strengthening be important? What questions does economic evaluation of health system strengthening address? And how does EE of HSS differ from the standard use of economic evaluation to look at new technologies like medicines, vaccines, and diagnostics? And then what would be the best way of moving forward for conducting an economic evaluation of a health system strengthening intervention? So, economic evaluation of technologies, and note the meaning of technologies here. It includes medicines, vaccines, and diagnostics. So traditionally, economic evaluation focuses on alternative technologies within a disease or condition-specific evaluation. The important point here is the disease or condition-specific lens that is normally taken within economic evaluation. And just to remind ourselves, any economic evaluation considers 2 or more alternatives for achieving a particular outcome, where one alternative is normally the status quo, and sometimes the status quo might be doing nothing. So here are 3 examples of different diseases or conditions: HIV/AIDS, human papillomavirus, and HIV-associated cryptococcal meningitis. And these would be the status quo interventions, and these would be the new alternatives that one would be considering. So the first being TDF or tenofovir in first-line treatment for HIV/AIDS, the second being a vaccine for HPV, and the third being a specific kind of a diagnostic for cryptococcal meningitis. So what is being considered is whether or not these new things might represent cost-effective uses of scarce health system resources. We also can do in a quite standard way an economic evaluation of a model of care. So, for example, if we look at these 3 diseases or conditions, substance misuse, pregnancy, and HIV/AIDS, the status quo on substance misuse might be doing nothing, but the alternative is a psychological treatment called a brief intervention based on motivational interviewing. And so that's not a technology in that it's not a vaccine or a medicine or a diagnostic, but it is a model of care intervention. And just as with the technologies, one can quite readily assess the cost effectiveness of a brief intervention. One can quite readily assess the cost effectiveness of home-based antenatal services in comparison to facility-based, or a group community health worker run service offering in comparison to nurse run service provision. And the reason why it's quite straightforward is because all of these are taking a disease or condition specific lens. So where does health system strengthening fit into all of this, and how might we evaluate the cost effectiveness of health system strengthening? So the first thing is that it is quite difficult actually to define health system strengthening. And if you look at the literature, there isn't really a clear definition. I know this because I've evaluated this literature. I've done a systematic review, and one of my big challenges was coming up with a definition. But what we can say is that there are some common elements. The first is that health system strengthening interventions tend to be horizontal or system-wide. They tend to be associated with investing in the health system platform, and they impact across multiple disease-specific or condition-specific areas. For example, an electronic information system for primary care will provide benefits across a multitude of different kinds of conditions and patient groups. Quality of care initiatives for inpatient care will improve the care for all inpatients, not just for HIV inpatients or COVID-19 inpatients. It will improve all things for all inpatients. And supply chains for vaccines will strengthen vaccine distribution across all of the different vaccines that are to prevent multiple different diseases. So the thing we know about health system strengthening is it's quite fine to assess the cost. That's totally doable. But it is more difficult to assess the health gains for a number of reasons, including that these interventions have impact across many different disease-specific areas. So it's quite complicated, but it is nevertheless very important. And this is an old quote coming from Murray in 1994, where he says that cost-effectiveness analysis of health interventions, which are more often than not disease-specific, tends to neglect the role of the health system in delivering these interventions. There are no explicit analyses of cost effectiveness of improving the physical or human infrastructure of the health system, which provide for direct comparisons between investing in the delivery system and purchasing more specific interventions delivered from that health system. So why is this important? Because the question is, we really would like to know whether investments towards health system strengthening would generate more value than investments in specific medicines, diagnostics, or vaccines within disease-specific areas. And this is a really important question, to be honest with you. So in my own country, there is a tendency to modify our clinical guidelines quite regularly to include more diagnostics or medicines and so on and so forth, without thinking about whether our health system platform is able to cope with these additional technologies, and without really evaluating whether we could gain more value by strengthening the platform in comparison to bringing more technologies down. So these 4 photos are taken from a project that I did in rural Mozambique, where we were looking at health system strengthening interventions. And I'm going to give you a few examples in relation to this rural setting of why I think economic evaluation of health system strengthening is important. So the first photo is of the health worker accommodation at this. It was a community health center. It was a 24-hour facility, and this was the accommodation for the health workers. So a question then would be, would bolstering health worker morale through improving accommodation generate more value than specific medicines and diagnostics? This next picture is of the solar panel that they have at this health facility, and the solar panel only functions to power the vaccines fridge. They do not have any other form of electricity coming into their facility. So a question would be would an improved source of electricity generate more value than additional specific medicines and diagnostics? And this photo is of their delivery suite where women come to give birth. And so a question here would be, would an improved delivery suite generate more value than specific medicines and diagnostics? So generally, the question then becomes, how might we extend economic evaluation to enable a comparison between investing in disease-specific technologies versus investing in health system strengthening, such as infrastructure, quality of care, or information system. And the problem that we have is that we're comparing apples and oranges. So it's quite difficult at the moment to get things onto the same sort of measuring rod. So we've got apples and oranges, and what we need is fruit salad. So how shall we get to fruit salad? So just to summarize where we are so far, these at the table at the top gives a few examples of economic evaluation of technologies or models of care. And the second table gives an example of economic evaluation of health system strengthening interventions, where in a tertiary hospital setting, we might have do nothing in comparison to a quality of care initiative, or in a primary care facility, we might have a paper-based information system in comparison to an electronic information system. So technology or model of care interventions tend to take a vertical, disease, or condition-specific perspective, whereas health system strengthening interventions tend to have horizontal or system-wide impact. And how do we compare these apples and oranges? So as I mentioned earlier, I've recently completed a systematic review of economic evaluation and health system strengthening from low and middle income country settings. And the majority of these health system strengthening evaluations do in fact take a disease-specific approach. So here are a few examples of what I found. The first is of a cost effectiveness or cost utility analysis of a quality improvement intervention for integrated management of childhood illnesses in Kenyan hospitals. And so what they did was they did calculate a unidimensional outcome for the cost effectiveness analysis, and this was expressed as a percentage improvement in process measures of quality of care per admitted child. So that was their unidimensional outcome. But they also estimated a multidimensional outcome, which was a sort of modeled daily averted from mortality reductions per admitted child. So that's how they overcame their challenge. Another example is a cost effectiveness analysis of mentorship and enhanced supervision to improve quality of integrated management of childhood illnesses in Rwandan rural health districts. And here they proposed a unidimensional outcome of additional child correctly diagnosed or additional child correctly treated. So they didn't go into the cost utility analysis piece. A third example is of a cost analysis of integrating nutrition commodities into the medical commodity supply chain in Kenya. And for this one, they just did a cost analysis and there was no attempt to estimate health gains from the improved supply chain. So in summary, a cost effectiveness or cost utility analysis of health system strengthening. It is in fact possible to take a disease-specific approach just as you would with new technologies. And in my opinion, this will provide you with an initial understanding of the economics of health system strengthening. It will also provide some comparison to technology or model of care interventions and starts to enable us to turn apples and oranges into fruit salad. The weaknesses of such an approach, however, are that you're going to miss the system-wide impacts of many health system strengthening interventions. For example, your enhanced supervision or electronic information system in primary care will improve outcomes across many disease-specific areas, yet you will only probably be able to see it within one vertical area. Similarly, infection control in inpatient settings will improve outcomes across all inpatients. However, the guidance that we're giving is to consider it within a particular tracer. And leadership development for district managers will improve morale for health workers and outcomes across many disease-specific areas. But again, you can get some initial understanding of the economics of health system strengthening by choosing a disease-specific tracer. If you were to instead decide to do a cost analysis of health system strengthening, then the strengths of that approach are that costing is Not that easy, but it is relatively straightforward because you are not going to attempt to measure health outcomes from changes in disease-specific areas. But the weakness is, as with all cost analysis, you will not be able to say whether this is value for money or not. Some examples of this is you could do a cost analysis of something like your nutrition commodity supply chain, and even though it impacts on multiple disease-specific outcomes, you will not attempt to measure these. You could do a cost analysis of a leadership development program for district health managers, which will likely improve patient care across the entire district health system platform, but you will not attempt to measure these outcomes. That said, it is important, in my opinion, to complement your cost effectiveness, cost utility, or cost analysis by looking at the costs of scaling up and the budget impact more broadly. So to summarize, my recommendations are, if you do a cost effectiveness analysis, do take a disease-specific approach and measure unidimensional outcomes as they relate to what it is that you're seeking to achieve. Slightly better, perhaps, would be to extend your cost effectiveness analysis into a cost utility analysis, but then you would need to model your multidimensional outcomes as quality adjusted life years or disability adjusted life years. And the example I've given you from Edwin Barraz's work in Kenyan hospitals provides you with one example of how to do that, and I think he did a really good job there. And finally, if you only do cost analysis, so you leave out the health outcomes, then it would be possible to take a disease-specific or sort of tracer approach, or in fact, to consider a system-wide approach. For all of these, if you take a disease-specific approach, then your option is to assess the system-wide costs of scaling up and the budget impact to complement your disease-specific lens. Thank you very much indeed for listening, and I look forward to meeting you online sometime soon.